Hello, everybody. I'm extremely excited to be a part of this meeting today, and I want to introduce Docpro. And let's go to the first slide. So, good thing is like we know that how big the problem is because we are seeing like all these innovators here. They're talking about EMR. They're talking about like how to optimize their workflow, how to bring like joy in practicing medicine. So our actually tagline is very simple, that we help practice thrive, right? So how we are doing it, we are actually trying to make the doctors administrative work more efficient. We are reducing the administrative burden, and at the same time we are making sure that the doctors are getting highest revenue they're supposed to get. So first thing is like we already proved ourselves in multiple practices in New York. And this is Dr. Atal Chaudhary, president of NYC Docs, has multiple practices there. And once we started working with him, we showed that how we increased the revenue by 37%. We actually increased the claim submission 3 times faster. Also, we increased the new patient retention. At the same time, it's like almost faster, like 30% faster completion of the charts. So the way he said, I loved it, and he said that, like Docpro actually make my practice like a well-oiled machine. So that's what we are. So one thing I always like to say that what the mind doesn't know, the eye cannot see. The doctors being physicians studying medicine for a long time, it's actually quite impossible to understand all the healthcare nuances in USA, right? So every day the systems are changing, and change is the only constant here. So every time in terms of coding, in terms of like billing, value-based care, population health, things are changing every single day. So to be up to date with all this healthcare system and be generating more revenue at the same time like reducing the administrative tasks, it's crazy. So first, like how we are doing it. We are actually helping in pre-visit planning, as also like our fellow presenters say that it's very important because the first thing is checklist. Because decision fatigue is one thing most of the doctors are suffering. Because every single day, the amount of clinical decisions they have to take is kind of quite crazy that if we expect them to do all the administrative work at the same time doing all the clinical decisions. So we want to give them a checklist to make sure that, what are the things pending for the patients before they see, and at the same time, the coding suggestions and everything so that they can optimize their revenue. Next, we are is going to the coding optimization again. And very important thing here, I want to mention that the HCC coding, which is actually connected to value-based payment right now. So if we are thinking about the cost savings, and then we are thinking about like the reduced hospitalization, at the same time, if you want to make sure the primary care physicians are actually using the right HCC codes to make sure that the total amount of revenue allocated for them, they have to use the HCC coding. And that's where our next feature is coming, which is easy referral. We want to make sure that when the primary care physicians are actually referring to the different specialists, they're receiving the consult notes back. It's a huge pain point for most of the doctors. So there's one story I'd like to share here. That what happened, that this is not only about the primary care physician, not only about the specialist, it's also about the patient. One of the patient, very young patient, he had like high blood pressure, and then the patient was having palpitation. So the primary care physician mentioned that, why don't you go to the cardiologist? He didn't think that it's actually important enough for the patient to go to the cardiologist, and eventually the patient ended up having a syncopal attack in the middle of the road. And eventually he was hospitalized in Bellevue for almost like 21 days. The gist of this story is the referral loop. How can we complete it? How can we make sure that every patient, every primary care physician, at the same time, and every specialist are in the same loop, and we're making sure the loop is completed. So next is closing the care gap. This is big in New York right now, in some other states also, that the quality incentive payment. How can we unlock the quality incentive payment? All the work you are doing, you are making sure that patients are actually getting the screening done and all, but sometimes the reporting codes are not given. Sometimes this is all the Excel files, all those like data are not actually sent to the insurance companies. So we want to make sure that, the doctors are getting reimbursed for all the work they're doing.
Dr. Hassan, 1 minute to go.
Yes, so the last is value proposition. So what we are doing, so we are actually targeting at unit level. We want to make sure the doctors are generating more revenue for every encounter with the right coding and also with the charting. and we are reducing the administrative tasks by 25% because we are working on top of the EMR. So every EMR we can work on, and the doctors, it's quite impossible for the doctor to ask for them to change their EMR. So there's a huge market here. It's like a $60 billion total market size, and we are here. What is the ask? So here definitely we want to know more doctors. We want to get more referrals for the physician investors and great minds here, and we want to connect with the brilliant people. And at the same time, I think all the problems were mentioned before, because this is a big problem, that the physician burnout and all these things are already we know. And this problem is getting bigger because every single 10,000 patients are actually getting into Medicare, and definitely primary care physician shortage is there. So we have a great team,
and kindly wrap up now.
and thank you so much.